Hi all, welcome back to Nursing Guru for our another live series sessions which is related to the PPG. PPG means what? Pharmacology, pathology and genetics. Okay, so Hular wants to write the examination for pharmacology, and as well as that we have the subject like pathology and genetics. Okay, so third semester Hula studying in the third semester students are there, no? So for them these subjects are there. Okay, so listen here, what will be happen, you have to focus more on this particular subject because this is a quite dry subjects. Why? Because so there is a different kind of pronunciation we used to use in this particular drugs, for example pharmacology. Okay, so one by one we can discuss. Don't worry about the things, your examination is tomorrow, so 1 hour complete live series, and in that live series I will give you the important questions at last of the session. Okay, so kindly watch it out. Okay, why? Because most of the people were failed in the pharmacology due to the lack of knowledge which they are having to write the examination, because they don't know how to attend the questions. Okay, what is the pattern of answering methods? So that and all the tips today in this live session I would like to teach you. So completely watch this session. Okay, hope you guys are understanding my pronunciations, hope you guys are able to hear my voice. If you are not able to hear my voice, kindly chat in the chat box. Whatever the doubts which you have, please do comment in the comment box, and we will definitely make sure you to clarify your doubts. Okay, so we will start the class. Are you audible? One second, this is yesterday class. Okay, so we will start with a new page. Yeah. Okay, good evening everyone. Already while are watching, you people come to know that by seeing the thumbnail itself, we have started the classes which is related to the PPG. I will call this as a PPG, later I will explain. Okay, so the subject is, one second. Sorry for the inconvenience. We got one technical error, so that is why I cut the live. No issues. No issues in that. We will start again. Okay. So same energy. You have to listen our classes, and you will get the benefit of that. And we will start the subject which is called PPG. I told you this. Okay. So subject is PPG. Okay. Why ma'am is telling that PPG PPG? What is this PPG, madam? So PPG is that 1P stands for pharmacology. Okay, so this and all you already know. Why I'm explaining, some people are not knowing this also. That is why. Okay, so I want my students to know everything. Pathology, and the last one is genetics. Okay, so genetics. When we are studying, this is a only one part subject. Okay, so when it comes to the semester batch, now it's a part 1 and 2. Okay, so this part 1 and 2 will be there, and this is also part 1 and 2 will be there for only the semester batch. Hope you guys are understood, my dear students. Yeah, okay, so this much you are able to understand, right? Hmm. Okay, so now you may think that try to understand the things which is like, we have the things, we have three subjects. Okay, so the paper will be also togetherly which will come. So but we will write the pharmacology first and second together, pathology first and second together, and genetics. Okay, so this is how we are going to be study this particular subject. Okay, so 1 second, you give me a time that I will tell you the things. See, especially when we are studying this pharmacology, so that is one of the very important subject for nurses to while which will be helpful in the administration of the drugs for the patients, right? So pharmacology. Okay, so the pharmaco, which means the drugs or the medicines. Okay, so drugs or the medications. Logy means study. Okay, so logy means what? Study. So what we will do is that we have to study thoroughly about this particular subject regarding the each and every kinds of drugs. Okay, so in the same basis only the chapters also going to be designed. What you people are understood about this particular subject? So okay, 1 second. Yeah, so we have around in the first part. Okay, let me take one by one subject. Okay, so I will take this one, pharmacology. Okay, so the pharmacology, the subject is while we are studying. So first, pharmacology first is having a 8 units. Okay, so in this 8 units, you have to thoroughly study about the pharmacology. So each and every units will be designed based on the drugs only. Okay, hope you understood that one. Okay, so now you listen that in the first unit we have a introduction to pharmacology. Everywhere it is the first unit will be introduction only. Okay, so why? Because madam, why? You can ask that, why madam introduction to pharmacology? You will never ask. My students and all are brilliant only. So see, if first you lesson itself, first unit itself, why we are learning the introduction part means we don't know what is pharmacology. Okay, so this pharmacology is a vast subject. Only the minimalistic part we are going to be studying the nursing. Okay, my dear students, have you heard about this B pharma, D pharma, and Pharm D? Okay, so lot of knowledge you have to acquire in this particular field. And the same meanwhile, why as a nurse we need to study means we are the frontline peoples to administer the medications. Hope you understood this, right? So listen now, introduction to pharmacology. Okay, so introduction to pharmacology, what you have to focus more. So from this particular unit I will expect the questions like either it may be the multiple choice questions, or it may be the 2 marks questions or 5 marks questions we can expect rarely. Okay, so there is no chance to get the questions which is related to the first unit, the longest type of questions. Okay, so that we can later discuss. Okay, so Have any doubt? Are you guys having any doubt? Please do comment it down. Please do chat in the chat box. Okay, so I will try to answer for you. Okay, so hope you adjust with this flow, or else am I fast? Who are watching, no, please answer for my question. Anyone can answer for me in that 4 members or 5 members, like you please answer to my question that. Okay, so my flow is okay. Even I'm fast, you tell me. Okay, I will make you to adjust my flow, because even we started the classes which will going in the flow. Okay, so don't worry, 1 or 2 times I will explain you. Okay, so this is the introduction part. In this introduction part, most of the time we are going to study about the definition, branches, and nature and sources of drugs. Okay, dosage, forms, and route of drug administrations. Okay, so drug administration routes are very important. Okay, routes of drug administration. Okay, so we will call routes IV, IM. Okay. Hmm. So, drug administration route is very important. You can expect the question, either it may be for 2 marks. Yeah, 2 marks question we can expect. Okay, so list out the routes of drug administration. Like this question we can expect. Okay, so 2 marks question. Okay, then dosage also we have to know here. And the terminology is, lot of drugs are there: antiemetics, okay, antipyretics, okay, so antidiuretics, okay, so diuretics. Okay, so like this kind of drugs we have, my dear students. So initial phase, those are the drugs which, diuretics are there, no? Okay, so furosemide and all the diuretics. Example, we have a furosemide. Okay, so for one example I will give you that furosemide. So in initial time, our tongue will not going to be slip it off for this particular drugs to pronounce. Okay, so certain drugs are very difficulty to pronounce, even though we can pronounce it by practicing those things. Okay, especially in the upcoming lessons I will explain, you know. So by the time you have to go through the drugs, okay, especially wherever you are going to, for example, I said you, right, you want to go and write about the diuretics, so you have to list it down the diuretics. Okay, so that is very important. Hope you're understanding what I'm telling. Okay, so that is very important. And eventually what you want to do is that you have to list it down wherever, whatever the question they may ask. Okay, suppose they are going to write about the antiemetics, antipyretics, diuretics, you have to list it down 5 to 6, or at least 5, or maximum you can list it down 10 drugs, for example. Okay, so that much drugs you have to keep it in your brain or mind, so that will make sure you to succeed in the examination. Otherwise you will not supposed to get the marks in the examination. So my point is that you have to mention the drugs names. Okay, under the categories, while explaining under the classification of the particular group, while explaining you have to give a examples. Okay, examples you needs to provide. Okay, hope you understood this one. Okay, so now we will go with the things which is like the first unit itself. In that, pharmacodynamics. Okay, pharmacodynamics. In that pharmacodynamics, we are going to supposed to know about the actions of the drug. Okay, so antiemetics, if you are providing the antiemetics, what is the action of the antiemetics? That is going to be stop the vomiting sensation or the nausea sensation that we have. No. Okay, for example, ondansetron. Okay, so emisset. Okay, so these are the examples. Okay, so that is how you have to keep it in your brain, that which drug classification which may we can able to provide for the particular disease condition, not a provide write administer. Whenever the drug will come, that time you have to administer. Okay, so use the word administer. The next one is that in that pharmacodynamics, pharmacokinetics, two things will come. Okay, so in the pharmacodynamics we have to know about the drugs which is related to their actions, drug, then tolerance, receptors, and therapeutic adverse effects, toxic effects, and pharmacovigilance. Okay, so pharmacovigilance, we are going to supposed to know about this particular thing. Okay, so in the pharmacodynamics, action, majorly we are focusing on the action. The pharmacokinetics is that absorption, bioavailability and distribution, metabolism, interaction and excretion. Okay, so the how it will be interaction and excretion process which will be taken place after the consumption or the administration of drug into the body, and how it will be works. Okay, so like how it will be digest and how it will be excrete. Okay, so that process we are going to be study out in the pharmacokinetics. Okay, so why I am explaining all these things, so this is the way of writing one particular drug. Okay, so that you have to use it off in your answer writing. Okay, keep it in your mind. Okay, so next thing is that classification, the abbreviation, perception, drug calculation and weights and measurements of the drugs which we can able to study in the classification. Next one is review, principles of drug administration and treatment in individualization. Okay, treatment individualization, factors affecting the route. Okay, so this is also important. Indian pharmacology, then legal issues and drug laws, scheduled drugs and rational use of drugs. Suppose I am using of certain drugs, for example antiemetics. Okay, so you have to know that why I am using this, what is the action, what which will be happen in the body, what is it will, why we are administering this one, you should know. The next one is that is what rational. Then principle of therapeutics which means treatment, what are the principles of the therapeutic. Okay, so these are which will comes under the first unit. The second unit we can go pharmacology of commonly used antiseptic and disinfectants. Okay, so here we are going to focus more on the antiseptics, list out the antiseptics. Okay, that question we can expect. Commonly used antiseptics and disinfectants. So these are the drugs which maybe you are using for this antiseptic solutions and as well as the disinfectant solutions we used to use for the cleanliness, the purpose of cleanness, that cleaning the things. Okay, so for sterilizing, for disinfection, disinfecting purpose we used to use the certain solutions. Then composition. Okay, so the composition of the antiseptics, action and dosage, route, indications and contraindications, drug interactions, side effects, adverse effects, toxicity, and role of nurse. Okay, so in that we can expect the questions like list out the antiseptics or list out the disinfectants and write about the complete compositions, action and the side effects, toxicity and composition and contraindications, drug interactions, adverse effect of particular antiseptics, and as well as the explain the role of nurse in administering the antiseptics. Okay, so these are the common questions which we can able to expect from the second unit. Now we can move to the third unit, drugs acting on GI system. My dear students, drugs acting on the GI system which is related to the gastrointestinal system. So in that gastrointestinal system, whatever the drugs which we can able to use, that drugs you have to, for example emetics and antiemetics and laxatives and purgatives, and the next one is antacids and antacids and peptic ulcer drugs, antidiarrheal, fluid and electrolyte therapy. So this, okay, so these are the drugs which we can able to study in the third unit. Okay, so this is the second unit. Third unit, drugs acts on GI, which system? Gastrointestinal system. Okay, so emetics, antiemetics. The next one we are providing like peptic ulcer drugs, certain antacids. Okay, antacids we used to provide to reduce the gastric incidence. No, antacids. Okay, so certain solutions will become, no, so those are like cramafin and all will be there. No, for example I'm telling, so those are the antacids which we can able to provide for the patients for reducing the stomach interruption. So that time we used to use that things. So those are the important drugs. Based on this particular one drug, they may ask for the five marks question. So regarding the composition, okay, so whatever they may ask about all in this classification of drugs, you may take one drug, and suppose if they are asking about this one, you take that particular drug and write it in the order of composition and action. Okay, so then what we can write at last, you can write the role of nurse. Okay, so here you wants to write the things which is that toxicity, we can write it of side effects, route of administration. So this is how we need to write. Okay, so the action you should write, and dosage you have to write. Take one if you are writing about one drug, put a one table and write it down. That will make sure you to ensure the page also you can able to adjust off, and you can able to get the things which is like, you can finish it off in one thing. Okay, one like one page itself you can finish it off the answer. Next, fourth unit, drugs acting on the respiratory system. Okay, drugs acting on the respiratory system. Okay, so in this particular unit, that which we can able to see that asthmatics, okay, bronchodilators. Okay, so for example salbutamol inhalers. Okay, so the next one is decongestants and expectorants and antitussives and mucolytics, bronchoconstrictors and antihistamines. Okay, so we are studying about the anti-asthmatics, decongestants, and we have the expectorants and antitussives and mucolytics. Okay, so reduce the mucus. The next one is bronchoconstrictors. Okay, so bronchodilators also, and antihistamines. Okay, so these are the drugs we are studying under the respiratory system. Okay, so which will be the drugs acting on the respiratory system. Okay, so that list out and the classification and listing out the drugs, and write it off. I already told you, no, write on the, so anti asthmatics, bronchodilators, which is called as bronchodilators. Next one we have that congestant. So this is what it will be, the classification, write the composition and write about the route of administration, then side effects, toxicity, and you have to focus on the things which is related to the dosage. Okay, so like this you have to write the particular drug classification, list it out the antiasthmatics, okay, bronchodilators, for example salbutamol. Okay, so salbutamol inhalers. So the next one, you have to write the adverse effects, side effects, and toxicity, and the role of nurse. Okay, role of nurse administering the respiratory drugs which is acting on the respiratory system. Role of nurse, no need to forget. Okay, so that role of nurse, what is the role of nurse? She should have a first she should have a means she have not having the right to administer the drug without higher authority order, which means that doctor is not prescribing. Without prescription she can't able to administer the drugs. Okay, so that is what. The next one is drugs used in the treatment of cardiovascular and blood disorders. Okay, hemantinics and treatment of anemia. The next one is treatment of anemia, and the next one is the cholinergic and anti-cholinergic and adrenergic drugs. Okay, adrenergic drugs and anti anginals, anti-anginals. Okay, so which is related to the angina pectoris and all, which will be angina. Okay, so chest pain. So related to that we are using the anti-anginals. The next one is antiarrhythmics, antihypertensives, and coagulant and anticoagulants, and antiplatelets and thrombolytics, hypolipidemics. Next one is plasma expanders and treatment of shock, drugs used to treat blood disorders. So these are the drugs which will comes under the cardiovascular diseases. So these will be going to be right in the same form. Okay, next one, drugs which is used in the treatment of the endocrine system, insulin. Okay, so diabetes and hypertension which we can able to see in this particular endocrine disorders. Okay, so diabetic insulin and orally polyglycemics and trio thyroiodine, thyroid thyroid drugs and steroids, corticosteroids, anabolic steroids. Okay, then calcitonin, parathormone, and vitamin D3, and we have calcium metabolism, calcium that is which will called as calcium salts, we can use it off. So this is all about the drugs act, which is the drugs used in the treatment of endocrine system. Okay, mainly we are using the glycosemics, and we have this glycemics, and which we have the insulin drugs which is related to the diabetes. Okay, so that is the major drugs. So that you have to study about the composition and all, whatever I told you, know that you study about that. And next one is that drugs used in the treatment of integumentary system, which is that we have the antihistaminic and pruritics. Okay, antipruritics which we can use for this one. And topical administration will be there, topical application of the skin, means which we are applying. Okay, in the ointment form we are using this one, no. So that kind of drugs. Antihistamics, drugs used for the integumentary means skin. Okay, so based on the skin related disorders, whatever the things which we can able to use, those drugs you have to study. Okay, so most of the time we are using in the form of route will be topical route. Okay, so applying. Okay, so the drug which we can able to apply on the skin. Okay, so we are pouring on the skin and we are rubbing, and we, that is how it will be observed in the action which will be taken place if it is any kind of things which will be happen to this drug. Okay, so this much you study in the anti you used in the integumentary drugs. Okay, then drugs used in the treatment of communicable diseases, common infections and infestations. So for that you have to use general principles of antimicrobials, pharmacology of commonly used drugs like penicillin, okay, cephalosporin and aminoglycosides and macrolides, broad spectrum antibiotics and sulfonamides, quinolones, okay, antimicrobials. For example, antimicrobial infection, anaerobic infections, uh, drugs and anti proside drugs and anti-malarials, antiviral drugs, and we are using this like for example if anybody have a viral fever, that time we are using the antiviral drugs. Okay, so anti-malarial drugs, okay, this quinocol will be there, no, so that one. The next one is antifungal agents. Okay, so these are the things which we can able to study in this particular 8th unit. Okay, so far we have discussed all the units in the part first. Okay, so the next one is that pathology. Pathology, we have the units like, you know, 3 unit will be there in the first part. First one is, okay, so let me discuss about the pathology. I will give you at last I will give you the important question. Okay, so pathology part first. In the pathology first part, what I'm telling you, know, so this is the patho means disease condition, logy means study. Okay, so the study of disease condition which will be called as a pathology. In that first one is the introduction. From that unit you may expect the questions like 5 marks, 2 marks and multiple choice questions also. So in that you are going to study about the important and importance of the study of the pathology, definitions of and terminologies of the pathology, cell injury, etiology, which means causes, pathogenesis, how it has been spreaded, okay, how it has been developed, okay, of reverse, one second, reverse and irreversible injury, necrosis which means cell death. Okay, so the next one, gangrene, how it will taken place, the gangrene, cellular adaptations, atrophy, hypertrophy, hyperplasia, metaplasia, dysplasia, apop apoptosis. Okay, so these things you have to study, this terminologies. Okay, then inflammation, acute inflammation, chronic inflammation, that two types will come, no, that you study. And in that also vascular and vascular and cellular events, systemic effects of acute inflammation. Okay, so the next one is chronic, in that granulomatous inflammation, systemic effects of the chronic inflammation you have to study. Next, wound healing. Okay, so neoplasia, the next one, circulatory disturbances and disturbances of the body fluids and electrolytes. These three topics which will comes under the wound healing. Okay, so sorry, wound healing is a different topic, this neoplasia and circulatory disturbances, and we have the disturbance of the blood fluid and electrolytes. Okay, so these three topics you have to study. Wound healing you study thoroughly, the stages, everything you have to thoroughly study. Okay, so this is all about the first unit. Next we can go with the special pathology, pathological changes in disease condition of selected system. Okay, so in that particular system, in this unit, second unit, you are going to study all the systems. Okay, respiratory system, pulmonary infections, pneumonia, lung abscess, okay, pulmonary tuberculosis, whatever the disease condition which will comes according to the systemic wise, no, in the pathology, students, you learn that the pathogenesis properly. Okay, whatever the system, whatever the disease condition which may come. Okay, same the in the second unit you are going to study about the respiratory system like pulmonary infections, pneumonia, lung abscess, pulmonary tuberculosis, chronic obstructive pulmonary diseases, COPD, and chronic bronchitis, emphysema, all disease condition development. Okay, so that you are going to study in this one. Next one, cardiovascular. So the cardiovascular, atherosclerosis and ischemia and infraction, rheumatic heart disease, infection, sorry, infective endocarditis. Next one is that gastrointestinal tract. So that is peptic ulcer, gastritis, oral mucosa, esophageal cancer, gastric cancer, intestinal, thyroid ulcer, inflammatory bowel disease, IBD, and Crohn's disease, which is also called as Crohn's disease, and ulcerative colitis. Okay, the next one is colorectal cancer. These are the major important questions which we can able to expect in the all the system of the unit. Next one is liver and gallbladder and pancreas. Liver hepatitis, amoebic liver abscess and cirrhosis of liver. Gallbladder, we can expect the cholecystitis and tumors of liver, gallbladder, and pancreas. Okay, pancreas, which may be that pancreatitis. So how it will be develop. Okay, so this pathophysiology will be, we have studied, no, the development pathogenesis, you have to write it off here in the pathology. Okay, next one is that skeletal system, bone healing, osteoporosis, the porous formation in the bone, that is called osteoporosis. The next one is the osteomyelitis, tumors, joints, in the joints, arthritis, rheumatoid arthritis, and osteoarthritis. These three conditions you have to study. Next one, endocrine system, diabetes mellitus, goiter, and carcino carcinoma thyroid. Okay, these three related to the hormone issue, then the endocrine system you are going to study. Okay, so these are the second unit. Must and should from this particular unit only 10 marks questions we can expect in the pathology. Okay, hope you are understanding. Next one is that hematological test for diagnosing the blood disorders. Okay, so in this one only, in the pathology, certain blood tests are there, so that procedure will be there. For example, hemoglobin test will be there. Okay, so one test is there, which is we can take our blood and we can able to test it off. Okay, and the grouping will be there. Okay, so many tests will be there, anti-malarial test and all that test you have to study, and you have to write the procedure of it and the role of nurse in that particular thing. Okay, so the blood test, hemoglobin, white blood cells, and platelet count, PCV, ESR. Okay, so these are the things. And coagulation test like bleeding time, proto, prothrom, prothrombin time, BTCT we will call, no, that one. And the next one is activated partial prothrombin time. Okay, APTT. This test will you have to study. Then blood chemistry, blood bank. Okay, regarding the blood bank, in that blood grouping and cross matching, blood components, plasma phoresis, and transfusion reactions. Okay, so few lab hours can be planned for this one, which means the certain lab hours will be there. The procedure, majorly you have to focus on the procedure. Okay, so this is all about the things which is related to the pharmacology first. Okay, so hope you finish it off pharmacology. In that particular second unit only you are going to expect the questions for 10 marks. Okay, sorry, 10 marks or 15 marks question, long essay question will come from that. And the second one is pharmacology 2. So the pharmacology, later we can discuss about the genetics. Okay, don't bother about that. So in the pharmacology 2, how many units we have means we have around here also 8 units will be there. Okay, so here only 8 units will be there. So the pharmacology 2 also we have the 8 units. So drug acting on the disorders of ENT. Okay, so ENT and eye will be there. Okay, so antihistamines, topical application of eye. Okay, so for example, chloramphenicol. Okay, so whatever the drops and all topical administration will become, no, those drugs which will be acting on the eye, ear, and nose. Okay, so throat, so those drugs are going to study. So again I will tell you the composition you study. The next one is drug used in the urinary system, which means which is related to our kidney. Okay, so renin, angiotensin, tensin system, then diuretics and the antidiuretics. Next one is drugs toxic to kidney. Next one we have the urinary antiseptics and treatment of UTI and acid fires. Okay, so these are the things which you have to study. Okay, so for example, UTI means which syrup the doctor will prefer citralca, no? So that is, and that you have to study. Okay, so not citralca, the drugs. Okay, the entire drug group. Okay, for you relieving this UTI, whatever we are giving, no, that composition you have to study. Okay, next one is drug acting on the nervous system. Here we are going to study about the analgesics and anesthetics and analgesics are like, for example, non-steroidal anti-inflammatory drugs. NSAIDs is there, no opioids, non-opioids, the full, the classification NSAIDs will be there, no, so that full classification you have to study. Okay, antipyretics, which is related to the fever. Okay, the next one is opioids and orthocentral analgesics. Okay, in that general and gases also will be available, and hypnotics and sedatives. Okay, so hypnotics and sedatives for making the people to sedate, we used to use certain drugs, no. So the next one is skeletal muscle relaxants and antipsychotics, mood stabilizers and antidepressants, anxiety drugs and anticonvulsants. Okay, drugs for neurogenerative disorders and um miscellaneous drugs we used to use. Then stimulants and all will be there. Okay, so that is all about this third unit in the second part. The next one is drugs used for hormonal disorders and supplementation, contraception and medical termination of the pregnancy. Okay, so for example, estrogen and progesterone hormone we used to use that for pregnancy and all, and MTP, for MTP we used to use misoprostol. Okay, so those are the drugs. Then oral contraceptives and hormonal replacement therapy, hormones, the estrogen and progesterone they used to use the hormones. The drugs for infertility, medicate termination of medical termination of the pregnancy, and uterine stimulants and relaxants, and so this is all about the hormones. Okay, so that for sure you will get the question in the 5 marks question. Next one, drugs used in the pregnant women during the antenatal, labor and postnatal period. Whatever the pregnant women drugs which we can use in the all three phases, no, that is okay, tetanus prophylaxis and iron vitamin K1 supplementation, oxytocin, misoprostol, and the next one is that ergometrin and methyl prostaglandin F2 alpha, and next one is this one, okay, calcium gluconate. Okay, so these are the drugs composition, action, side effects, toxicity and dose, route to role of nurse you have to write. Next one is miscellaneous drugs used for deduction, drugs used in CPR and emergency adrenaline and IV fluids and electrolyte replacement, common poisons, drugs used for the treatment of poisoning. Okay, activated charcoal, IPEC, antidotes. Okay, antidotes and anti snake venom. So this and all. Okay, so that you have to study for this one. Emergency drugs and all will be there, no, that action, composition, everything you have to. Immunosuppressants and immunostimulants. Next one, introduction, drugs used in alternative system of medicine. Okay, Ayurvedic, homeopathy, Unani, Siddha, like 5 Ayush courses there, no, Ayurvedic, yogic, we are not using any kind of drugs. Only this Ayurveda, Siddha, homeopathy, Unani, we are using the drugs. Okay, so drugs in for common elements. Okay, so certain drugs we used to use for all these medical branch, that you have to study. Then fundamental principles of prescribing. Okay, so whatever the fundamental principles we have to follow for prescribing the drug. So perspective and role of nurse practitioner, introduction. So nurse practitioner. Okay, so that is one of the courses there that you have to focus more on this, the 8th unit. Okay, so regarding the role and responsibility, legal and ethical issues related to the prescribing in nursing. Okay, nurse practitioner and principle of prescribing, steps of for prescribing, whatever the steps she or he has to follow while prescribing the medications, and prescribing competence tendencies. Okay, so that is the major things which we have to follow in this particular last unit. Okay, either they may ask for the 2 marks, what are the principles, or they may ask for the 5 marks question. Okay, so from this particular unit, second was over. Next one is pathology second. Okay, so pathology second, special pathology you are going to study. In this all the system also you are going to study, but you are going to study or in organ wise. Okay, so for example, kidney and urinary tract, glomerulonephritis, disease condition only, the development, all the disease condition you study. I will not going to tell you each and every disease condition, but you have to study the all the disease condition. Next one is meningital systems. Okay, for example, cryptochidism and testicular atrophy and prostatic hyperplasia. Sorry. Female genitalial system. Okay, carcinoma of cervix, carcinoma of endometrium. Okay, cancer, uterine fibroids, vascular mole, and choriocarcinoma. Okay, so ovarian system tumors. Okay, so these are then breast we have the fibroids and all will be there, no, fibroid adenoma, carcinoma of the breast cancer. So related to that development, pathogenesis you have to study, and the role of nurse, and as well as central nervous system, meningitis, encephalitis, stroke, tumors of CNS. This much is enough. Next one is that clinical pathology examination of the body cavity fluids. Okay, method of collection, everything you have to study in the second unit. Okay, so in the part 2 we have only 2 units. Next one is we have the genetic. Okay, so in the genetics, that is one of the important subject. In the genetics we have introduction, maternal and parental genetics influences development of the, this one will be there, no. So we have around 5 units. Okay, so in this particular genetics we have the certain units. So that first unit introduction, second unit maternal and paternal and genetic influences and development of defects and diseases. Okay, so certain disease conditions will be there, no, that one. Okay, uh, this one is condition affecting the mother, genetics and infections, and consanguinity. So consanguinity means consanguineous, which means what, in relation only they used to get married. Okay, so that one. The next one is maternal drug therapy. Okay, all those things. Okay, the you are going to infertility, then spontaneous abortion, ectopic pregnancy, Down syndrome, trisomy 21, that you have to study in the genetics. Okay, that is very important, Down syndrome and as well as the trisomy, must and should they will ask about this one. The next one is genetic testing in the neonates and children. Okay, the screening for the genetical disorders, congenital disorders and abnormalities we have to know before this pregnancy. Okay, for example, cleft lip, cleft palate will be there, right? No, so that and all we can able to predict before the pregnancy itself. So which means due before the labor, before the birth itself. Okay, so that is why we has to use lot of test. Okay, so for example, now we have the what we can say, that one test is there in the pregnancy, that Doppler test they used to do. Okay, to find out any kind of abnormality which will be there. Okay, so in the high risk pregnancy and all, this may be the very common, right, in the current situation. So that is the next one is that screening test will be there, no, for the congenital abnormality, developmental delay and dysmorphism. Okay, so this and all you have to study in the screening. Okay, genetic test and procedure will be there. So 2 marks question only you are getting from this particular unit. Okay, so the genetic condition of adolescents and adults. Okay, so for example, cancer genetics, familial cancer, cervix cancer is very common right now, inborn errors of metabolism, blood group alleles and hematological disorders, genetic hemochromatosis and Huntington diseases, mental illness. Okay, so these are the things which we can see in the adults and adolescents and adults, so that we can see. okay, that we have to study all these disorders. Okay, next one, services related to the genetics, genetic testing, gene therapy and genetic counseling, legal and ethical issues and role of nurse. This is very important, either you will get the questions from this particular unit, 2 marks question. So and meanwhile all the multiple choice questions we are getting from the genetics only. So far this is very short subject and you are going to get these things which will be very necessary. Okay, so this is the only the syllabus review. Most of the things they are asking about the classification, okay, the classification of the drugs when it comes to the pharmacology. So there, okay, so there you have to study and write it off all the study better, you study all the classifications, and as well as you have to focus more on the pathology, which means all the disease condition, the pathogenesis and the role of nurse. Okay, so the pathogenesis you have to study, and genetics also you study this much unit, means multiple choice questions easily you can able to crack it off. Okay, so those are the important topics what I have discussed. Okay, I'm not dragging the classes. Okay, whatever the important, that much only I have told. Okay, based on the syllabus. Okay, with the syllabus only I told, I was not taking anything, I was not preferring any kind of things, only with the syllabus where you have to focus. Okay, so what are the things which will be there, that I have explained. So if you want the more things, you can comment it off. Now I will going to wind up this class. So next we are having another session, so we will meet up with the second semester students for sociology. Thank you so much who are watching. So presentation, I will tell you 1 second presentation before going to the presentation, class wind up. Okay, so pharmacology, while writing the pharma, so composition, drug name, first is drug name, classification, dosage, dose, route. Okay, route you have to write. The next one is composition. Okay, action. Okay, next one is sometimes action, side effects, or they may ask adverse effects also. Next one is toxicity. So this is how it will be there, dear. Okay, so you have to write it in this form only. Classification they are asking, use the flow charts. So okay, so use like this flow charts. You can list it off the classification of the particular drug group. Okay, so these are the thing you have to focus more on this pharmacology. Okay, only the pharmacology tips I'm giving. Okay, at last administration. Okay, route and all if you're right, means role of nurse in administering the particular drug, must and should you write it off and come. Okay, so this is how you have to answer for the pharmacology. So this is the tip, you have to focus more on this. And next one is that pathology. Okay, so pathology we will get the questions like procedure. While explaining the procedure, you may write the principal objectives. Okay, so then how you will do this particular procedure of the test. Okay, so that is how you have to answer. Okay, so hope you understood how you need to write. If they're asking about the disease condition, write it about the more on focusing on the pathogenesis. Okay, so pathogenesis of the particular disease condition. Oh, okay, in order to all the respective systems whatever there in the syllabus, focus more on the syllabus. Who all are writing again and again pharmacology supplementary students, so better you follow this particular method to write the particular drug, that is definitely going to get. Okay, so if they are asking about certain drugs classification, write it down the examples. Okay, so 5 to 10 examples you have to give, it off. Okay, you have to write it off in your paper, then only you will get the marks. Okay, so this is what about the pharmacology, pathology and genetics. Hope you guys are understood how to write the examination. That is what I focus more on this particular subject. Thank you so much for watching. Thank you.